morning, Christy Santos here with Windermere. We love real estate and supporting our community.
Between property showings, we love to stop at our favorite businesses, talk with local owners, and bring their stories to you.
This is our Bellevue Eastside.
Well, hello there, friends. The Cowboys here once again with another interesting and good interview, especially if you have children or grandchildren and you're new to the area or you've been in the area and they haven't been taking care of their teeth. We are here at Expedition Pediatric Dentistry with Dr. Megan Miller. Welcome, Megan.
Thank you. Thank you for coming. I'm so excited for you to be here.
Yeah, it's our pleasure. So this is important. As you know, Cowboy always says it's important to take good care of your teeth, brush, floss, and get annual checkups. But it's even more important for our children. So we're going to talk to Dr. Miller a bit today about why that's so important and about the different services that they offer here. But first, Dr. Miller, I'd like to talk to you a little bit about your background and how you got bonus points because I know you got some Texas roots, so the Cowboy loves that. So share with me about how you ended up here in Bellevue, Washington.
Yeah, well, so actually, I sort of had a circuitous route coming here to Washington. I'm an 8th generation Texan, so my whole family's back in Texas, and I went to dental school, college, residency, the whole shebang back in Texas. But I really always loved the Pacific Northwest. I interviewed for residency up here and I really liked it. It just didn't end up working out. So I kind of always had a crush on the Pacific Northwest, so to speak. And then my husband works in the tech industry, and so it really made a lot of sense for us to make the jump from Austin to the Pacific Northwest. So here we are, and we lived on Bainbridge for a couple of years.
Oh, perfect.
We really loved living on Bainbridge. It's such a beautiful spot. But my husband was commuting over here to Bellevue. So that was kind of brutal, ferry, traffic, all that jazz. So then we were like, where are we gonna land? What are we gonna do? And of course, Bellevue is just such a great, the Eastside is really such a lovely place to live, so it was an easy choice. We like being a little bit closer to the skiing too, I'm not gonna lie. That's a nice pull. So we really enjoy it here.
Good. Well, we're happy to have you in the neighborhood. So I got a question for you. I got to know, it's such an interesting name, Expedition Pediatric Dentistry. How did that come about?
Yeah, well, so I knew I wanted to I sort of thought of my theme more than I thought of the name first, actually. Mm-hmm. I see it that we're like a guide or a Sherpa, so to speak, on the journey of oral health. And so it's like we're taking your child on an expedition. And we're here to guide them through each step. And it's so much easier when you have a guide, right? If you're trying to figure it out on your own, it's gonna be a challenge. And it's still gonna be a challenge. We're not saying we can magically make your kid love to brush, when they're like a screaming 3-year-old. But we do know that having helpful advice and having somebody there to support you, give you scientific information, that can make the difference between no cavities and lots of cavities. So it's like we're trying to start that out early and be a guide along the way. So Expedition really fit with that theme that I envisioned of like nature, adventure, the journey, the hike, the process, and it just really spoke to me.
So unlike Josh and Expedition Unknown, you
yes,
know where you're going.
We know where we're going. We've been there before.
That leads to my next question, because you're doing pediatric dentistry. What's a great age to start kids coming to the dentist?
That's a really good question, and we do get that question a lot. A lot of times parents think that they don't need to come until they're like getting a little bit older and their teeth are kind of getting all squished together. But really the best time to go is within the first year of the eruption of the first tooth, because then we can go ahead and start getting vitamins on. They're most vulnerable when they first erupted. So getting a dose of vitamins on is a good step. And as you might imagine, they would get accustomed to us and used to going to the dentist if they start earlier. So psychologically, it really helps for them to have those easy visits in the beginning instead of their first experience being like, oh no, we have a cavity, we have a toothache. So that's like, those are the things that really break our heart, is when a kid comes in and they're like maybe 7 and they've never been to the dentist and now they've got a toothache. And then we're already setting ourselves up for a really hard appointment. and we haven't built any trust. So it's much easier if we can jump in on the front end and prevent the cavity and also build relationships so if something hard happens down the line, we're ready for it. So it makes a big difference to start early.
My personal experience was more what you described, not quite as early, but my neighbor was a dentist. He took care of me since age 5, and I would go in there and, I'd fall asleep during a root canal, right? I mean, I just trust.
We love that.
No fear.
Yeah.
And everything, and I think what you're describing, get these kids in early, just when that tooth breaks, and getting them exposed and enjoy coming here, right?
Absolutely, and we work very hard to make it as fun and enjoyable. We know this is still hard, but we make it as fun and as enjoyable as humanly possible. So, but it's a good point you bring up, because I went to a lecture recently about dental anxiety. And they had some pretty good statistics showing that about 75% of adults that have dental anxiety, it's from a childhood negative experience. And it makes sense, right? Like if that means their brains are working, it means their brain is smart and they're understanding that if this was a negative experience, I should be scared when I come to the dentist. Yeah. So it's like anytime we can avoid that altogether, we're just gonna have a better relationship with oral health as we get older.
Well, I had a lot of negative childhood experiences, but I'm thankful dentistry wasn't one of them.
That's very good news.
So is there a progression from just starting those vitamins to, when do cleanings start for kids?
Yeah, that's a really good question. So sometimes at age 1, they already need us to clean their teeth. Like it depends, So we're gonna do like a thorough exam and kind of look around and decide what we need to do at that point. So occasionally we do go ahead and do a cleaning. Sometimes though it's more of just looking around, getting used to the place, getting the vitamins, and then you're underway. I would say though, typically we push more around age 3. That's kind of like the age we really want to make sure that we're getting used to the cleanings, getting accustomed to all our tools and everything that's going to be, touching those teeth, and we call it tickling your teeth, right? Like we want things to feel normal as much as we can. So I think also families who use a powder or a spin toothbrush, the kids feel a little more comfortable with our toothbrushes because it's a little bit more similar to the kind of toothbrush we use here in the office. But it really does depend on the patient's needs. So every kid's gonna get a little bit of a customized plan based on what they need. There's also some kids who the first time they come, they barely make it to the waiting room, they don't make it in the back. And that's okay, we just have a good time. We make sure we end on a positive note, and then we say, let's come back in a month. And maybe that's all we needed to get done for the day, and we're gonna have to try to make it a little further next time, So it really just, our goal is to build that positive relationship and build trust with everyone. That way, parents and child, that way we can make sure that they're having a positive time.
Well, as they go through the different stages, and now we've gone from vitamins to teeth cleaning, as their teeth start to fall out, is it important to bring them in as that process is going in?
Yeah, that's a really good question. So, sometimes we get the comment from parents like, oh, they're just baby teeth, we don't need to worry about them. Like that can definitely happen, the perception. And I will say that once they're getting close to coming out, I do worry about them a little bit less, right? Like if a cavity starts to form on a tooth that's about to come out, we're not going to put a filling on a tooth that's about to fall out. That would be totally pointless for us to put a filling on a tooth that's about to come out. So there are certain time points that are more essential or more crucial to that tooth being able to stay in the mouth. And so in my head, I'm always thinking, how long is this tooth going to be there? And that way we can plan accordingly. But it's also interesting because as you're losing baby teeth, you're getting grown-up teeth. And so that's the time they're most vulnerable, is when they're first coming in. And so it's a great time for us to make sure to put vitamins on those teeth, put sealants if they have really deep grooves, like trying to protect those adult teeth, because it's a really vulnerable time in your child's mouth. Or if we have started braces, sometimes we need to see kids more often because it's harder to keep your teeth clean when you're undergoing orthodontic treatment. There's just a lot more surfaces for bacteria to grow on. So that can kind of throw a wrench in our plans. of how to take care of those teeth. So we're trying to really make sure that we protect them as much as possible going forward. But again, it's still that kind of customized plan.
Well, that's a good segue into my next question. I was going to ask, what age range do you start recommending that they go see somebody for braces?
Yeah, that is a really good question.
Is it typical? Is it after the adult teeth start coming in, or just before? Or what?
You know, it's interesting you asked that, because for a while it was like everybody seemed to be starting braces really early, and that was kind of unusual for a while. And I think the pendulum has finally swung more in the middle, where not everybody needs to start when they're really young. So some kids, it's better for them to wait until all the baby teeth are out. Other kids, we really do need to jump in earlier because they have something that's going to cause problems coming in. And so we're trying to get it taken care of before the tooth erupts. So it's really actually a very nuanced decision about when we refer to the orthodontist and how we work with the orthodontist to make that plan. You know, it's just, we have a huge selection here of amazing orthodontists. And so I often like to refer families to more than one office so they can find somebody who really fits their philosophy, because you're spending a lot of time with your orthodontist. It's every 4 weeks about that you go in. So it's like, that's a serious relationship. And it's not like you can just pick up and change orthodontist. You're making a commitment to that orthodontist. So we really want to make sure that parents are like super happy with their choice of who they've selected, because that makes a big difference in that orthodontic relationship, and it definitely impacts the success of the treatment.
So you have a referral list, so if you get a client here that's coming in from Newcastle or Kirkland or Redmond, you can refer them to an orthodontist.
Exactly, because it does, and that is one thing. You might be okay to drive someone or somewhere a little further for your cleanings every 6 months, but you probably want somebody really close to home because you're going every 4 weeks approximately. Yeah. So you really do want somebody in your neighborhood that's really capable, really competent, and really good at what your child needs. So it's specific to that kid for sure.
So on average then, when you start referring children for braces and stuff, is that like in the 7 to 10 range?
Yep, that's pretty much it. 7 is kind of, I would say there's occasional 6-year-old that we refer. And there are some orthodontists who will see kids even younger, that will see kids around age 4 or 5, but typically there's not orthodontic needs that we can do at that age. You know, it requires a very unique, mature child to be able to handle that. Most of the time it's 7, 8, 9, 10 would be the normal age.
I'd like to talk about some of the other services that you offer. You had one on your site that was a 50-cent word and threw this little cowboy for a loop. So, frenectomies?
A frenectomy, yeah.
Did I say that right?
Yeah, you did. You
hey,
did,
one for the cowboy.
Yeah, impressive, yeah. No, a frenectomy, yeah, not every office does that, and not every pediatric dental office does that. It's a little bit unique. It's basically, I actually had one when I was a child. They were even more rare back then.
Can you show me what it looks like?
Yeah, it's like this little band of tissue under the tongue or under the lip. When that band of tissue is too tight, it can cause problems. It can cause problems for kids with either talking, swallowing, especially for breastfeeding for infants. It can cause a lot of issues. It's kind of a controversial topic because some people believe that it's being overused. But I would say that's why we do a really thorough exam, and we try to make a very clear diagnosis of what the problem is, because we want to make sure that if we're doing it, that it really is going to help. So, and a lot of times, like if a baby is not gaining weight or not nursing and feeding properly, it's a really nice thing for us to be able to do to get that baby back on track. And so it makes a really big difference. The other kids that are always like, it's life-changing, are the kids who are struggling to speak. So if they're going through speech therapy and they can't pronounce certain words, like they can't put their tongue in the right spot because it just won't physically go there, then when we do that release and they work with their speech therapist, it's like night and day, and it's really transformative. And honestly, it's one of the more rewarding procedures we do because it's such a gratification to the family, you know, to be able to do that for their child. And for moms, sometimes nursing is very painful, and so it can make a big difference in the comfort level of the mother. So it's pretty impressive what we can achieve. So yeah, so we work really hard to take care of those babies and young kids that need that procedure.
So frenectomies, is that related to or just a different name for tongue tying?
It's absolutely related to. Tongue tie would be like the diagnosis kind of, like, or the real $20 word is ankyloglossia.
Ooh.
So yeah, ankyloglossia means the tongue is like stuck to the bottom of the mouth. So ankyloglossia is the diagnosis, or tongue tie. And then frenectomy is the procedure. So that's the diagnosis, the procedure is frenectomy. And the frenectomy is what releases that tissue.
Just so you know, tongue tying is nothing like hog tying.
Yep, I can confirm. Nothing like hog tying. I have hog tied before, so I can confirm.
Okay.
Not the same.
So one personal care. So is that a whole education process about the importance?
Yeah, we definitely want to start. You know, I have a funny story that when I went to dental school, I remember I came like home one day, called my mom on the phone and was like, Mom, why did you never teach me how to floss? Like, I learned that like you're supposed to use like a long piece of floss and you're supposed to get like a new fresh piece as you go along. And I was like, Mom, you never taught me that. She was like, oh, I just assumed the dentist was teaching you that. You know, she was like, I thought you were gonna learn that when you went to the dentist. Like, I didn't realize I needed to explain that to you. So, you know, I think not to say that parents are intentionally neglecting their children's oral health education, but I think that, you know, there's always little tricks and tips that we can use. And a lot of times we'll ask parents, like, what are the obstacles you're facing with your oral hygiene routine? Like, what's making it hard? What's working? Where can we tweak it? You know, like, what strategies can we use? A good example would be sometimes kids just really, really hate brushing. Like, they absolutely, maybe they're like 3 years old. They have limited verbal skills. They can't really explain all the time exactly why they hate it, but they hate it. And something sometimes so simple as changing the type of toothpaste, like either the texture or the flavor, that kid can go from hating brushing to loving brushing, just from a small change. So a lot of times when we find those little things we can tweak, it makes a really big difference, and we see like really huge improvement in quality of brushing from just little differences. So it's all about, like, you know, dialing in on that kid's needs. So that's our approach for that.
The next thing was evidence-based dentistry. Is that just like looking at x-rays and determining what's going on?
I would say a better description of that would just be that we're trying to incorporate the latest research. So I think a lot of times people will say, like, we use cutting edge technology. Well, you know, while cutting edge technology is nice, that actually completely discounts all the research that's maybe boring to everyone out there, but exciting to us dentists, you know? Like, so when I say evidence-based dentistry, I really mean that we're gonna be utilizing the latest and greatest research to try to improve your kids' oral health. And sometimes that means knowing the way the research is trending. So it might mean that we are picking up on trends in the literature and saying, okay, this is what I think the next big thing in pediatric dentistry is gonna be, and here's how we can start incorporating it. But I also don't like to like experiment on kids. It's not like we're gonna be going out of our way to pick something that's untested. And unfortunately, sometimes that is true, right? That people are trying so hard to be the latest and greatest that they're kind of getting out in front of the research. And that's not where we wanna be. We wanna be where the research is strong and where we know that there's strong evidence for the procedures that we're doing and strong evidence for the things we're recommending. And I think it's actually a hard path to be on because it requires us to constantly be learning. We're really working hard to make sure that we provide the best, most recent research about whatever your child needs.
There was something pretty interesting on your website that I liked too. You were talking about your holistic approach to dentistry. So what's all encompassing that holistic approach?
Yeah, so there's two things that means to me. The first is that I really think that for each child, we have to take a holistic approach about their psychological development. And so, for instance, if a child is really, really anxious and we force them to do some procedure, that procedure better be like life-threatening, because we should not be forcing a kid to do something that isn't going to have a huge impact on their health. to decide if something is worth potentially traumatizing a child, it needs to be a pretty big deal, right? So in other words, being able to let go of the little things, like if a child doesn't want to brush, of course I would like to brush their teeth and make them look shiny and beautiful, but also the brushing that you do at home every night is more important than the brushing that I do here. So if I'm going to cause a negative reaction or a negative association with toothbrushing, it's much more important for us to preserve the parents' relationship of brushing at home. The brushing that we get done in a dental office is important. I don't want to discount that. But it's much more important for us to have healthy routines at home. So kind of trying to always balance those two things is really important. And then second, I would say the other way that I view a holistic approach to pediatric dentistry is to recognize that the teeth are connected to the rest of the body. And so sometimes we see evidence of a vitamin deficiency, some sort of physiologic problem that hasn't been discovered by a pediatrician. And it's mostly because we're looking in the mouth a lot more than the pediatrician is. I mean, bless their hearts, they have a lot to worry about. They're worried about every little bone in your body. And we're able to sometimes catch things that they're not. So I view us as a team with the pediatrician so that we're able to really communicate well with the pediatricians about general health and how it connects to oral health. And I think most people now know about that. Most people now have learned that oral health is really intrinsically connected to your physical health. And the cardiac connection is huge now. Like, we understand that inflammation in the gums and inflammation in the heart go together. So I think we're more and more trying to be prepared and watch for those things. And then the same goes for like skin things, actually I am attending a course in a couple weeks and I'm really excited about it because I love skin. And we're right here in the face, and a pediatric dentist should be looking at your skin, and should be telling you if they see something. And so I think that's another way that we're kind of connecting the medical side and the dental side together. And that's really having like a holistic approach for each child.
I like skin too, it has me covered.
Yeah, it really does.
Yes.
Did you know it's really your largest organ?
It is?
Yeah, it's important. The integument, it's very, very important. It's actually the largest component of your immune system too. Most people don't
I
think
did
about
not
that.
know that.
Yeah, see, fun facts. So I've got lots of fun facts.
So did I see that you have some specialty services for kids with special needs?
Yeah.
Let's talk about that.
Yeah, so that actually kind of all connects really well to the holistic approach, because kids with special healthcare needs require us to be really connected to their pediatricians and specialists so that we can make sure that we're prepared to handle the kinds of changes to our treatment plan that have to come up. So we work really closely with the pediatricians and their specialists, and we make sure that we're following all their recommendations and checking lab work and all that stuff so that we can ensure that really the treatment that we're providing is done in the safest way possible. And I think having that awareness that children with special healthcare needs have really different priorities. So in other words, like we're gonna prioritize based on their specific healthcare conditions.
Well, the cowboy wants to applaud you because I saw on your website about your humanitarian and missionary dentistry in Belize and Mexico.
Yeah,
Can you share a little bit about that? Thank you for doing that.
Yeah, well, I've been going pretty much my whole career. Like even before I became a dentist, I've been doing dental mission work, and it started really in Texas. I got so lucky. I happened to volunteer at a dental mission event in Texas, and I happened to be working with this dentist, and we were talking all about the event, and he was like, oh, actually, I go to Belize every year on a dental mission trip. And I was like, can I come? Like, I was just like, what? That's amazing. And so I started when I was in college, before I even started dental school, and they would let me assist, like I would just be their dental assistant. And then I went for about 10 years with that group. So they got to watch me go from being a little, dental assistant college kid to dental student to resident to pediatric dentist. And I'm still very close with those teams because you obviously spend a lot of time with them, and you're in these very, well, let's just say tough situations, you know, sleeping in a hammock in the jungle, you know, it's not the easiest.
And you're not in a yacht in the middle of the blue hole working on patients?
I wish. We do usually go spend a day at least doing something fun, like, you know, spelunking or something. But it is really, it's really a challenge because you also don't have your normal tools. So like we had to hike out, you know, with a donkey carrying our, you know, our oxygen tanks so we could run our machines off the oxygen tanks. I mean, it's just like, you have to think really differently when you go do the mission work. So it's a very, very different process. The children there are just amazing, and they are so thankful to be there. And it's really, I mean, I know it's cliche to say that like you get more out of it than they do, but it's true. I mean, it's really so meaningful. Gosh, I'm gonna get like emotional talking about that. It's so meaningful to be able to take a gift and a skill that you've developed and then to go and just like really transform someone's experience. And I think that I mean, that's why I keep going year after year, right? So I feel very passionately about it. And it really means a lot to me to be able to do that. So it's really meaningful.
That's great. Are you doing anything like that within the local community here?
Yeah, so right now I'm actually serving as an officer in the Washington State Pediatric Dental Association, and so that group is focused a lot on advocacy. And so one thing we're doing is actually later this week, on Thursday, we're going to the Capitol and doing a lot of advocacy for some bills that we think would really benefit children's oral health here in Washington. And so we have like all our appointments lined up to meet with our representatives, and we're gonna be really working on the advocacy side. Nice. To make sure that we're really protecting children's oral health. And amazingly, and I can't take credit for it, I didn't go last year to Lobby Day, but last year they were able to achieve a huge improvement in our Medicaid system for dental health. And it was like a 40% increase in reimbursements. I mean, it was just amazing. And so some of the pediatric dentists here in Washington State have worked really long and hard to advocate for children's oral health. And we're really lucky because we have a pretty advanced group of people here. And we're lucky that they have worked so hard, and I feel honored to be a part of that organization because it's a really amazing group of people. So.
Before we wrap up here, we'd like to ask a couple personal questions.
Yeah.
Do you and your husband, can you share a little bit about like what some of your favorite restaurants are on Bellevue, Eastside? Where you like to do?
We love to eat out. Yeah.
I know, isn't that great?
It's funny, when we moved into our place, we thought like, oh gosh, our oven doesn't look like very used. And we're like, maybe it's just because they've been eating out at all these wonderful restaurants here in Bellevue. I think that's right.
With a lot.
Oh my gosh, we're spoiled. I will say, we are pretty big fans of Central and 520. I mean,
520 is awesome.
Those are like, we go there almost every week. I shouldn't even say that. It's so embarrassing. They like know us now. They like recognize us. I mean, we're really spoiled. And oh gosh, what else do we love?
Do you like parks, museums around here?
Oh, well, I mean, parks, yeah, for sure. And the Botanic Gardens. I come from a long family of plant people. You probably noticed we have some plants in here. So I love going to the Botanic Gardens. I mean, I would say we're really lucky. And then, you know, of course we like museums. We are excited about the rail going in, because I do think, you know, we would like to go over to downtown Seattle a little more, but the parking often keeps us from getting in our car and driving over there. So I'm pretty excited about the connection that's about to happen, because I think that's going to really encourage people to just hop over for like the symphony and then hop back. I mean, I think that's going to be a really wonderful addition for the Eastside. And then, like I mentioned, we do like to go skiing. So this is like the time of year we're really getting out and doing some skiing. But in the summer, we do a lot of hiking. My husband likes to fly fish, so I pretend to like it.
It's awesome.
I just go, I sit on the boat, so, I mean, I know how to do it, but I'm not good. Yeah, we really like outdoorsy stuff. And that is one thing that we love about living in Washington.
So, as we wrap up here, I want to give you a chance to tell us anything that I didn't ask about your practice here and what people should know about Expedition Pediatric.
You know, I think that it's really, can be very hard to choose a healthcare practitioner because you really want somebody who's going to fit your philosophy. or at least respect your philosophy and work with you on where you are. So I really urge people to not feel like they have to stick with someone. Like, you know, they need to, it's kind of like you got to kiss a lot of frogs sometimes, you know, like if you come to me and I'm not the right fit, somebody down the road will be, you know? So I think it's really, we're so lucky and fortunate that we are in an area where we have so many amazing practitioners that it's really important to find somebody that you vibe with, as the kids would say, the Gen Z would say, you gotta vibe with somebody, you know? So, you know, I think that's the important thing is finding somebody that really speaks to you and hears your concerns and, you know, can collaborate. And yeah, I think that was my goal when I opened the practices. I just wanted to make sure that I was finding ways to connect with people and collaborate and meet them where they are. Yeah, and also I'm very fortunate that I have an amazing staff. My team is really awesome, and I'm pretty spoiled. They definitely help make my day go better, and they make kids' days go better. And so I think that's one of the hard things too, is, you know, finding not just a doctor you like, but you want to like their staff. Like, you interact with their hygienist more than you do them, you know? Like, it's a big interaction that you have. So you want to make sure that it's a team you really like. So, yeah.
Well, Dr. Miller, it's been a pleasure meeting with you. We thank you for everything you've shared, and I think that our community is blessed to have you in it. So thank you for being here. And at the end of this video, we will provide the address and phone number so you can contact them and check them out as your new provider for your children and grandchildren. So thank you for watching, folks. Now, I got my big boy pants on, so I'm going to get up from the little boy chairs.
So true. It might be hard. You might need to brace yourself.
Well, that was awesome. You were great.
Well, thank you.
The door is fun.
And then these are such wildly popular little things. I would have never thought that the kids would love it so much, but they like run up and then they put their hands like,
Trying to find something?
yeah, they just want to look at everything. They love it. And that was one of the things our designers came up with, was these little, because these are custom made cabinets.
They don't have normal chairs either. They just lay down on them.
Right, and you know, because kids get startled sometimes when things are like, the chair moves and they get surprised. So these are really great because they don't move. You know, it's like laying on a bed or a bench, and it can feel really normal. Yeah, see? And the kids can feel really fun with that. And then each room or each chair has a
Expedition theme.
Yeah, an expedition theme, like a national park theme.
Nice.
So this is like the Rainier chair, this is the Olympic chair. And then our next one is Zion. A little Zion chair where our major lives in there. Yeah. And then of course there's things that I feel like I care a lot about when I designed the place, but that other people don't care about, which is like our sterilization area. You know, like I spent so much time working on the design in here because, I mean, it's one of those things where it's like you don't think about it as a patient, but for us, having a perfectly clean and organized space to keep everything sterile is so important.
Yes.
And so I feel like I probably spent more hours designing this than anything else in the office. So, you know, it's like all these little details that we get to
Just for
think
the
about.
older kids, it's a more traditional chair.
Yeah, well, and we do treatment in here. So if we have to do like a filling or something, we would come, or a sedation, we'd come in here and do it in this.
I like your tray with all the tools and stuff on it.
Yeah.
It's better than that thing that comes down.
Oh my gosh, yeah. And a lot of times for kids, it's nice to have it behind so that you're not like up in their face, you know? So, and the kids do great.
And what a great setting with the trees right there.
I know. I feel like our office is a little bit tricky to find, but I couldn't give up on this view. I mean, like when I saw the space, I was like, these trees are perfect.
Yeah.
So expedition-y, you know, like you just feel like
that
you're
is relaxing.
Exactly.
Right?
It feels so relaxing. It feels
decompressing.
Like you're in the space. Yeah.
Yeah.
So it's definitely like all these little things, you know, right away. And we can do a little exam.
You like the way I got that 50-cent word out?
You did great. Yeah, it's tricky. So,
I still don't know that $20 word you used.
Ankylosing.
Oh, yeah. I'm not even going to attempt that. So at Crater Lake, what's in
Oh,
here?
this is actually not finished
Oh,
yet.
okay.
So we haven't finished all the rooms yet. But
Okay. How long
yeah.
have you been here?
We've been here about a year, a little
Okay.
over a year. So yeah. But
Is that how long you've been on your own? Or did
yeah, yeah. Before that, I worked as an associate over when I was in Kitsap County.
Okay.
And
Well, I was reading this morning, the next big trend in pediatric dentistry, cowboys with lasers.
I can see that. I can see that.
Laser shooters, come on, open wide.
Yeah, exactly. And lasers are getting really big in dentistry, so I could see it happening.
See, there you
Maybe
go.
I'm gonna actually. I have often dressed as Jessie the cowgirl for Halloween, and I'll tell you, it's the perfect dentist costume because you get to wear your jeans, and so you can still, do all your work, your pedal on the floor, and it's not getting in your way. Your chaps are very comfortable for pediatric dentistry, so I've done it many a time.
There was something.